Welcome to Therapy Facts with Dr. Jenn. Today, we are talking about the Kirk Franklin documentary and the Kirk Franklin interview at Club Shay Shay. Point number 3 deals with when your parents were children when you were born. Whoa, okay. So, this documentary and this interview resonated with so many people because they have experiences of having unavailable fathers and mothers, not knowing who their father or their mother was, and or not having a chance to get closure, to have the parents to take some accountability for not meeting the needs they had when they were children. And so, one of the big things we talk about in therapy when parents were children, when the client was born, is really being able to see the childness, if that's a word, of their parents. So, if you had a parent who was 16, 17, 18, 15, 14, 13 when you were born, and you're now 40, 50, 60 years old, you can either choose to see, the client can continue to choose to see the parent as this this bigger than life person that they were when the client was a child, or they can choose to see the child that their parents were when they were born. And choosing to see your parents as who they were when you were born, and especially in terms of capacity for parenting, it does not negate your experiences of having a gap between what you experienced and what you needed. Those emotions do have to be processed and grieved in order for you to move on. However, it can be a lot easier to move on, to process, grieve, and move on when a client looks at the circumstance from the point of view of being a grown-up, them being a grown-up right now. And they can look back and say, wow, most of the time, or much of the time, they can look back and say, wow, there's no way that I would have been ready to be a parent at those small ages, no more than my parent was ready to be a parent. And so, again, some sympathy or empathy is developed. And the sympathy or empathy can help to grease the process of processing and grieving, to be able to understand, which is the biggest piece of the puzzle. Most of the time, when children experience trauma of neglect, abuse, not having available parents, not being owned by a parent, etc., the child assumes quite wrongly that it is their fault without any clear explanation for why things are the way they are. The child then imposes some control over the situation by assuming that it is their fault that their parents did not love them, did not take care of them, was not available. Whatever the behavior was, the child assumes responsibility. Now, a child is going to assume that responsibility as a means to control their environment in their mind, no matter what he or she is told by the adults around them. So sometimes an adult may say, I don't want to see you, or I'm mistreating you because you are bad, or there is something about you that has caused this. Other times, adults just don't say anything and they just don't show up. And then the adults who are providing the care may not say anything either. So whether the child is told they are bad, or they are not worthy of love, or they are told nothing but behaved in that way, people behave toward them in that way, then the child will assume responsibility. And so part of the reason that children, adult children, and even children need accountability and responsibility from their absent parents is because that little person needs to be relieved of an idea, or of the idea that there is something wrong with him or her, that they are the reason why the adult or the adults did not take responsibility or accountability. In Kirk's circumstance, it was both of his parents. In other situations, is one parent or the other, and also both parents. And so the little people inside need that person to say, hey, there was nothing wrong with you. You were perfectly lovable and you deserved my availability. You deserved me to be there in your life, showing you every single day how valuable, lovable, and treasured you were then and you are now. However, there was something about me that made me unable to take care of you and the responsibilities that came with taking care of you. And for that, I apologize. My behavior was in no way a reflection of your value and what you deserved. So that is what the child, adult or not, is looking for. But very often, the child that created that circumstance is not available, does not have the capacity to provide those words. And if the person matures past the original trauma that caused their behavior in the first place, then they will give you those words and they will give you the behaviors that you're looking for. But if you seek them and they are not available, most of the time it's because that person has not matured beyond the age of the incident, the age of whatever their original trauma was. And so being able to see the experience or the circumstance from an adult allows the adult then to tell themselves those things and to understand that in no way was it their fault that their parent did not do what they needed them to do when they were children. And if the parent still isn't able to have some sympathy for the parent still not being able to do that. And so, as we often say, nobody is coming to save you, but you can definitely save yourself.